Hi everyone, welcome back to Neurospicy Nursing. If you're new here or have already seen this, but maybe didn't get this uh, document that I've sent out to those who I tutor, here's a review of the rationale. These questions are going to go over the autonomic nervous system and kind of some information about the different sympathomimetics, sympatholytics, parasympathomimetics, and parasympatholytics. That's a mouthful. Um, but yep, same thing as the mock tests on ANS, GI, and that glaucoma one. Same thing with this. I am going to give you guys time if I don't tutor you and you didn't get this actual copy. I'll give you time to answer the question, or you can pause the video. There's going to be 20 questions that we're going to go through. And yeah, that's it. Yeah, just thanks, I guess. If you haven't already, go ahead and answer this question. So the correct answer to this one is actually going to be B. We are going to hold the medication and notify the provider because anticholinergics, remember, these are blocking that PNS system. Like this specific medication, actually can worsen urinary retention. Remember, what we're expecting with the rest and digest system of the body is that increase in urinary output, that increase in digestion. So when we're blocking it, we are going to worsen urinary retention. And just normally, glaucoma and BPH are going to be contraindicated with this medication because of the system that it's blocking. So the correct answer for this question is actually going to be B, advise the parent to remove the patch and seek medical attention. So the reason why is because with children specifically, this medication, the cyclopamine, can actually cause hallucinations. Um, just it's a normal CNS effect that happens in children. But we have to remove that patch and then medical evaluation is needed. So the correct answer for this medication is going to be B, expected anticholinergic effects. Dry mouth, blurred vision, constipation are very common side effects that you're going to see with anticholinergic medications or those sympatholytic medications. Um, it's not a sign of toxicity, by the way. It's just standard side effects. All right, so the correct answer to this question is going to be avoid driving until you know how the drug affects you. The reason why is because atropine, even though it normally increases your heart rate and your blood pressure, it can also cause drowsiness and blurred vision. So you have to make sure that you're taking safety precautions like in avoiding driving until you know what this medication is going to do to you. So the correct answer for this one is going to be C, narrow angle glaucoma, because anticholinergics increase intraocular pressure, and they're just contraindicated in narrow angle glaucoma. We are going to see sympathomimetics. So these are just the regular cholinergic medications, and the sympatholytics used for this type of glaucoma, or just really any glaucoma. So the correct answer to this one is going to be B. Bradycardia and hypotension are signs to hold the beta blocker because this medication, it's normal for them to drop their blood pressure, drop their heart rate. A heart rate of below 60 is always going to be hold the medication and make sure that you notify the provider. um, just generally when we're talking about the beta blockers. Um, so that's just something to keep in mind. If you see that their heart rate is below 60, we're gonna want to hold this medication. A lot of times too, if their BP, their systolic BP is below 110, it really depends on your patient though, but if it's below 110, we are gonna want to stop the medication as well. So the correct answer for this one is going to be C, rise slowly from sitting or lying positions. Um, a lot of times with these alpha blockers, sorry, um, first dose or orthostatic hypotension is really common. So just making sure that um, you tell them like, hey, make sure that you're getting up cautiously so that your heart rate's not dropping while you're standing up, is going to be really important for these patients. So the correct answer for this one is going to be C, asthma. Non-selective beta blockers, there are actually like cardioselective beta blockers, which you can give to patients if they do have asthma. But non-selective beta blockers, they cause bronchoconstrictions. Those bronchoconstrictions cause bronchospasms, and that's why they're going to be contraindicated in asthma and people who have COPD. So the correct answer for this question is going to be C, um, heart rate and blood pressure. So beta blockers, obviously we have an OLOL. That's going to be a beta blocker. They affect our cardiovascular system, right? So they lower our heart rate, they lower our BP. So we have to make sure that we're monitoring those things so that those don't drop to unsafe levels. All right, so the correct answer for this one is going to be B, the orthostatic hypotension and fatigue. If you remember for that case study four, I believe it was, where I was talking about how those alpha blockers, it's super common for us to see that orthostatic hypotension is going to be the same thing. Any of the sympatholytics, um, orthostatic hypotension is going to be pretty big, but hypotension in general, bradycardia, and fatigue are going to be very common side effects that you're going to see with these medications. All right, so the correct answer for this one, you are going to choose B. So epinephrine, it helps improve our airway, right? So when we are going through anaphylaxis, our bronchioles are going to constrict and our heart rate or blood pressure is going to tank. So when we give them the epinephrine, it's going to improve their airway and improve their blood pressure by stimulating the alpha and beta receptors. So that's why we're expecting that decrease in the wheezing because it's opening up that airway and then improved blood pressure because of just the epinephrine in general stimulating those alpha and beta receptors. So the correct answer for this one is going to be B, because albuterol, it says document defines and reassure the patient. So albuterol, it's working on the sympathomimetic like area of the medications, right? So they're mimicking that sympathetic nervous system. So tachycardia, like mild tachycardia, obviously not an obscene, like super high heart rate, but mild tachycardia and tremors are both going to be expected results of this medication. So we have to make sure that we're telling their patient, hey, this is normal, this is what's supposed to be happening, and try to reassure them and make sure that they're not overwhelmed by these side effects that they're getting. Because since it's mimicking that sympathetic nervous system, we're expecting the dilation of the airways to help reduce that severe coughing episode. But since it's mimicking it, we're also going to see that increase in heart rate and the blood pressure as well. And that's where the side effects come from. So the correct answer for this question is going to be B, a heart rate of 130 with new onset chest pain. Chest pain with tachycardia can indicate myocardial ischemia, heart attack. So this is something that's going to require urgent evaluation. It doesn't matter if they're getting something for their shock. Um, they still need to make sure that that is urgently evaluated, that they're not having a heart attack. Right. So the correct answer for this question is going to be, sorry, I lost my spot. C, the tachycardia and the tremors. So again, this is the same thing that I talked about with the albuterol. Since they are helping that firing of the sympathetic nervous system, we're expecting to see an increase in blood pressure. We are expecting to see tachycardia and tremors. And sometimes too, like just generally minus the tachycardia, minus the tremors, we also could see like an increase of their respiration rate because those airways have now dilated. So if they were below, like let's say they were like below 12, like at 10 or something, they may come back up to normal because of the agonist helping that site. So the correct answer for this one is going to be limit use to two puffs every 4 to 6 hours. Obviously, that is going to be dependent on what your provider tells you. But this is commonly the most teaching method that we use for this medication, just because since it's a rescue inhaler, overuse can lead to adverse effects like that tachycardia and that high blood pressure. So you want to make sure that you're using it almost kind of sparingly. Really only use it if you need it, because otherwise you're going to end up with um, the increase in heart rate and the increase in the blood pressure. So the correct answer to this one is going to be C, voiding within 30 to 60 minutes. Um, and that is because since it's stimulating your bladder, since it's working on the PNS system, it's making sure that you're voiding effectively. So that's a good sign. The PNS, like I talked about previously, you're gonna have that rest and digest. So you should be not hypersalivating, but you should have saliva production. You should have normal bowel sounds. You should be using the restroom regularly, both to urinate and to defecate. So that would be the correct answer would be C. So the correct answer for this one is going to be B. This medication, I can't pronounce it, I'm so sorry, but it improves an individual's strength. And it also is going to stimulate that parasympathetic nervous system um, to have like that GI cramping. Again, I had said that it's that rest and digest. So the abdominal cramping could be like the movement of stool and whatnot through the body. And then sweating is also very common in the PNS system. Um, and I forgot where I was going with that, but it is a common side effect of PNS medications. So the correct answer to this one is going to be B. So that little tear duct that you have in the corner of your eye that's close to your nose, we're going to apply pressure to that just because we want to prevent the systemic absorption. We want it to be more focused on the ocular pressure, not full-blown pressure in the body, like hypertension. You know what I mean? So by covering that duct, we're allowing it to just be absorbed by the eye. So common side effects of the agonists are going to be diarrhea and increased salivation. So salivation is also part of digestion, right? So if this is the rest and digest phase, we're expecting to see the increase in salivation because it's the very first portion of digestion. Diarrhea as well, because again, it goes along with digestion. Your GI tract is now moving faster, so you might have looser stools. All right. And this question, the correct answer is going to be C, asthma. Um, and that is just because they cause bronchoconstriction. Remember, if we're looking at the PNS and its kind of normal side effects, right? We have bronchoconstriction is normal. That happens when the PNS system is activated versus when the SNS system is activated. It's the dilation of the airway. So we're not going to want to give asthma to, or sorry, we're not going to want to give cholerogenic agonist, or we're not going to want to give adrenergic antagonists to individuals who have asthma due to the fact that they cause bronchoconstriction. So those are sympatholytics and our parasympathomimetics. We don't give these medications because they cause bronchoconstriction. All right, that's all 20 questions. Um, And that's really all I have for you guys. Any other questions, feel free to, if again, if you know me, feel free to message me. If not, feel free to drop a comment in the comment section down below. And don't forget to like, subscribe, and share this video to your fellow classmates to make sure that they are good on ANS before your guys' test. All right, bye-bye.